You're there? Yeah. So he's okay. I'll just post it. Good evening, everyone. Welcome to this live session. We are going to talk about baby milestones, and as we know, Dr. Rahul Adsul will be joining us. I'll just add him. He will be talking about 1 year baby milestones and the red flags that you should be looking out for. We're just waiting for him. Hello everyone. There's a good response here. Just inviting our doctor here. I don't know why it's not getting accepted. Doctor, I'll be inviting you because I don't know why it's not getting accepted. Yeah. Hello. Good evening.
Hello. Hi, good evening.
So we have
Can you hear me?
Rahul Adsul here. He is a well-known pediatrician and he has his diploma in child health, and he's more focused on scientific parenting, and that's what we're going to talk today about, the baby milestones. And like we know, all our children develop differently, and but these milestones help us to kind of have a guideline we can abide by. So please go on.
Yeah. So you're able to hear me?
Yes, clearly.
Okay. So hi, good evening everyone. So today I mainly wanted to discuss about milestones, but not basically all the milestones.
Yes.
What parents need to know when they are seeing their children grow up, what milestones they should look out for, how they should look out for. Like milestones are not same for every child. Every baby is different, so their growth will be also different. So what all they should look out for and when they should see a doctor.
Right.
So starting, it will be like, first of all parents need to know when they give birth or when their child is born, they should know how many weeks he was. Like every baby has certain weeks.
Right.
And that's what we call preterm or full term or post term. These weeks are very important for when we are considering milestones.
Okay.
And for milestones, we have to always use corrected age. So if your baby is premature, born before 38 weeks, around 32 weeks or 34 weeks, so you have to always use corrected age whenever you are considering milestones.
Okay.
So if he was born at 32 weeks, then you cannot expect him to be achieving all the milestones like a full-term baby.
True.
That will be wrong. Because even if they are born, their brain is still developing, still in the development process. And to do this, there are two different methods. One is, if you know what weeks you were when you gave birth, that will be the best. That is like the most accurate. Like for example, 38 weeks is considered as a full term.
Okay.
And if your baby was born at 34 weeks, so that is like 4 weeks less.
Yes.
So generally 4 weeks is 1 month, roughly.
So then what do you do, like those 4 months are like that one, when if it is like there's a lag of 1 month, right? So
yes, correct.
You don't consider that.
No. So for example, if your baby today is 3 months old, but he was born at 34 weeks, then whenever you are considering milestones, you have to consider him as a 2-month-old, not 3 months old. Yes. So this works when you know the weeks. If you don't know the weeks, then separate method is, gynecologists usually give you a date. This date, by this date you should probably deliver.
Delivered, right.
but then most of the times you deliver before. 99% of the time you deliver before. So you should check out the gap.
Okay.
So suppose if you are supposed to deliver on 1st of November, but you deliver on 1st of October itself, then again it is a 1 month early. So again, so if your born on baby was 3 months old, you have to minus 1 month from that.
Yes.
And then consider milestones as 2 months old baby. So this is very important. Second thing, what important is whenever you go to a doctor or whenever you ask for milestones, you have to tell them the history also, like how the birth was, whether it was totally uneventful, or whether baby had to be admitted in NICU, or if there were any problems during birth, or whether you had any problems during pregnancy, like low hemoglobin or any dengue, malaria, or any illness. These things are also important to know baby's development.
Okay.
And then if baby was admitted in, yes, tell me.
No, I was just coming to so how does that correlate with
So for example,
hemoglobin?
yes, for example, if mother had very low hemoglobin in pregnancy,
yes,
and then there is a chance that baby will be a IUGR baby, like growth restricted baby.
Okay.
If baby is growth restricted, then there are like 2 different types, whether it is symmetrical IUGR or asymmetrical. So this thing is very important because asymmetrical is good. Asymmetrical means brain is developing properly, but body is lacking. That is fine because as long as brain is growing, we are good to go. But if it is symmetrical IUGR, that means brain is also lagging.
Right.
Then this plays a very important role in knowing the milestones and knowing overall growth of the baby.
Okay.
Or suppose, for example, if your baby was admitted in NICU, so most of the time parents don't know what happened in NICU. They later on just come to us saying that kaach ke peti mein rakha tha, but we don't know what it was. And then when we check the file, and first of all, they come very late.
Okay.
So when we check the file, then we come to know that baby had fits, baby had low sugar at birth.
Okay.
And these 2 things are the most important ones for the brain development. If your baby has had this, then it is a very high chance that there is some impact on the brain development.
Okay.
But if you don't tell these things to your doctor, then you will never know what is the reason.
But for that to even communicate, the parent, they
yes,
know, right?
Correct. Yes.
Communicate.
So wherever they give birth, those doctors are responsible to communicate this to parents in detail. And another parent's responsibility is to keep the file safe.
Yes.
They always lose that file. It's very difficult to
have your there.
Yes, correct. So these are the basic things before you even start considering milestones.
Okay.
Then now when we come to milestones, like certain things are like very basic. You don't need to know all the milestones. Age-wise, it's very difficult to remember. For us also, it's difficult to remember. So there are certain things by age, like for example, at 2 months, smile is the most important for a 2-month-old baby. So if your baby is not smiling by 2 months old, then you should be little alert.
Right.
Yeah, and another thing I would like to add is these age groups. Like for example, I'll be dividing into 2 months, 3 months, 6 months, 9 months, and 12 months.
Yeah.
But these are ranges. Like even if I say 3 months, it is a range of 2nd to 3rd month.
Right.
If I say 6 months, it is a range of 5 to 6 months. So in medical field, it's always a range. It's never a specific time.
Exactly.
Like it's not must be 2 months means 2 months baby has to smile.
But then
it's not like that.
5 to 6, but it can be delayed also, right?
Yes. Right. So that's when the red flag signs come in.
Okay.
So this is a normal range, like 9. For example, how we calculate is out of 190 babies will achieve within this range, 10 babies will have little delay.
Right.
But that delay also has a limit. If it goes beyond that, then you should definitely go to your doctor.
Okay.
So it's like, so for 2nd month, smile is one of the important things.
Yes.
Then they start looking at you for a few seconds. They won't look at you like completely, but they start to look at you because their vision is developed now. They can start seeing colors. They can look at your face. They can see your face clearly. So that's why the reason by 2 months.
Okay.
So the range can be 2 to 3 months.
the vision is
at a certain distance.
a distance, yeah, not
Yes, yes. No, not very close, not very far.
exactly.
So that's why at 2 months, if you talk to your baby, you can notice that they're looking at you.
So
They
by
can feel.
recognize voices
Yes, voice they can recognize since birth.
since birth.
So their hearing, yes, yes, hearing is developed. But if you call out their name, they won't look at you at this age.
That is true, yeah.
Yeah, that starts happening only after birth. So they know where the sound is coming from, but the localization comes on later.
True.
So it's like that. Then they will start bringing their hand to mouth. That is one milestone at this age.
Yes, coordination.
And coordination. And they start to lift their head a little bit. Like if you put them on a tummy time, like when you start giving them tummy time, they start to lift their neck. Very few degrees and work very few seconds. But this should start by then, by 2 to 3 months of age.
Okay.
So this is like one of the milestone. And when you go for a 6-month milestone, by 6 months completed. Yeah, another thing is whenever we say a age, like 6 months, 7 months, it is a completed age, not 6 months started.
Okay.
So when I say 2 months smiling should be there, it is a 2 months completed and third month started. So for 6 months, baby should be able to at least start sitting with support. So what they do is they put their hands in front like a tripod position. We call it tripod position.
Yes.
So that they should be able to do. They should be able to hold toys in both hands and bring it to mouth. Then at this age, they can localize your sound. Like if you call them from some other room, they will try to look around who is calling.
The direction.
They won't know the exact direction. Correct. They won't know the exact direction.
But what I want to ask, like, with support, they can sit and all, right? But
yes.
So what I want to know is how much time can you make them sit like that? Because their spine's also not yet developed properly and all. So when we give them support to sit and all, how much time should they like sit in that position?
This is another one thing that people are scared of their spine.
Huh.
I don't know why. So their spine is very flexible.
I have no idea,
Yeah.
ho jayega.
Yes. No, their spine is very flexible.
Huh. No, but is it
So
okay
you don't.
to sit for longer hours and
Yes.
support?
Definitely. Yes.
Okay.
One thing is if a child is doing something on his own, like for example this tripod sitting position, they do it on their own. So they just put their hands in the front. Let them sit.
Right.
As long as they are comfortable, they will sit. When they are not comfortable, they will start crying or they will just lie down. So for that, we don't need to worry.
Okay.
And if you're giving them artificial support like pillows, making them sit on the sofa, then just make sure that they are straight, their spine is straight, and they're not bending forward or on sideways.
Yeah.
So just take care of that. As long as that has been taken care of, then they can sit as long as they are comfortable.
Okay.
Once they start crying, then you can change the position. Even for tummy time is the same thing. As long as they are comfortable, let them be. There's no like specific time. Yes, correct. There's no specific like 2 minutes, 3 minutes, nothing like that. Let the child decide. It's like that. So by 6 months, they will also about their language. They'll start babbling.
Yeah.
And they'll make lots and lots of different sounds, different noises. Sometimes some children like to scream at this time because they are just exploring their sounds. They have found new play that they can make some sound from their mouth.
Yeah.
So they like to make lots and lots of noises. Sometimes parents do get scared. Okay, my child is doing some weird sound.
So it's completely,
we don't know if it's
exploring.
Completely normal. Yes. Especially when they are sleeping, they love to like just keep on repeating one sound, like something like that. And almost all babies do this. I have seen.
Okay.
And parents get scared because they think they are putting pressure. They are not able to do potty. So they get scared. Okay, because something is wrong or they are constipated. And then when you look at the video, it's like child is comfortable, smiling, and just making that sound.
Right.
There is nothing to worry. All this sound cooing, we call it, and babbling, it starts. So once with letter syllable, ba, da, la, something like that, they'll start doing. So that should come by 6 months of age. and a sitting. So then when come to 9 months, they should be able to roll up, like at least from one side to another, either from back to front or front to back.
Okay.
And they should at least try to stand, like holding on to furniture, and they should try to stand. Some babies, very few babies, actually start cruising also. Cruising is they hold on to furniture and they like try walking.
Yeah, cruising.
Yeah. Cruising, yes. So 9 months is a little early, but some babies do that.
Yeah.
And by this age, they should be able to say mama, dada, like, or mama, 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 like 2 letters attached, or da, 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 da. So, like that. And then they should be able to completely sit without support by 9 months of age, without any support, like complete straight back, no support, nothing, no tripod position at all. And another thing they should neck control. This by 6 months I forgot to mention, the neck control should be there.
Right.
Complete. So when you are holding them upright.
Nowadays, if you see these like babies by I think 2-3 months, they have their neck support.
Yes. Even for smiling, I have seen so many at 1 month only they start smiling.
Yeah, they start smiling.
Yeah, it's very early. Yeah,
So
but still for parents we have to mention the age.
So this is basically evolution, right? Like they'll just start getting their suit.
Correct. Yes. I'm sure in few years these milestones range will also change.
Exactly.
They'll use little earlier.
Milestones change. Like if they, obviously by 1 month they'll be this, and by 3 months they'll be this. But then what do you say? Like, so the milestones that we currently follow, will they be then wrong completely after a few years? Because that's how we have been, doing with certain now. Most are, getting all these things. They're doing it faster. So the rest there'll be few who will not be doing it. So will they be termed as the red flags happening at that
point? No.
Right.
We will just increase the gap. Like for example, smiling, we are doing it. We are saying 2 to 3 months, it should be there.
Okay.
After a few years, it will become 1 to 3 months.
Okay.
That's it. The higher range we cannot reduce because then other children will be named delayed for unnecessary reasons. So that will remain same.
Okay.
But we never know how the evolution works. Yeah. And then by first birthday, the most important thing is they should be standing, no matter what.
Okay.
At least with support. Without support, so it's not possible, like not expected. But with support, they should be able to stand and at least try to walk.
Okay.
And in language, they should be able to say clearly, mama, dada.
Okay.
This thing is important. And obviously, full neck control, full rolling over. And they should be able to, if they're lying down, they should be able to, on themselves, get up and sit, like without any support, without we pulling them up.
Right.
So this is very important by first birthday.
Okay.
And words mein mama dada is more than enough. We don't expect them to form sentences, or we don't, in gross motor, we don't expect them to start walking independently. Some children do, because I have seen babies, they start at 10 months itself. So they do this. And there are now so many programs for brain development, or make your child start walking at 9 months and all those. So those who do, probably they get benefited. I haven't seen anyone.
Do these like, body coordination, like when we have certain plays, right? Toys, and we do certain
Yes.
Do these hand-body coordination help to get faster?
They do, because ultimately brain develops if your brain is stimulated.
Okay.
If you give continuous stimulation, it will develop.
Okay.
But it doesn't help for everyone.
Achha.
And it's not must also, according to me.
Okay.
So you let your child develop at this own space. Because what happens is, more than the child, the parents gets frustrated. They look at other kids and okay, his child is he's already walking at 10 months. Then they get panicky. They start giving some syrup, some multivitamin to the children, thinking, okay, something we should do, or get some 100 toys just to make them walk.
Right.
And ultimately and the pressurized child also, the parents are also frustrated, the money is also wasted. So it's like a vicious cycle.
Yeah.
So I tell them you try, you can try, there is no harm, but don't expect some miracles to happen.
Yeah.
Just because there is one child who is doing walking at 9 months, it doesn't mean that your child is delayed or that child is a genius. It's just that his brain developed faster. That's all.
Right.
Like that.
So
So all
then,
these milestones.
yeah, that's what red flags would do.
So these red flags and these milestones you have to know. If it is going beyond this month, like for example, your baby is not able to stand even at first birthday with support, then we should visit a doctor.
Okay.
Or your baby is not saying mama, dada, or not even mama, mama, nothing, no sound at all, then you should visit a doctor.
Okay.
Or at 6 months or at 9 months, he's not able to sit at all, like he needs support, or
Right.
completely lagging in support. Or at 6 months, if your neck holding is not there, then you have to visit your doctor.
Okay.
And online asking or online taking consultation is not going to help, because whenever there is suspected delay, we never name it as a complete like delayed development. We always suspect, and then we have to do certain assessment,
Right.
like developmental assessment, and also know the birth history. So from birth it starts. It's not like only right now, how is the baby. We go through the entire history. How was the overall development?
Okay.
Because there is a high chance that overall development was delayed. So he started sitting also late. So standing also started late. So that is fine. Or
And
sometimes the smile started late. Then
also,
rest of the
post 6 months, like your nutrition comes into play. So this
yes.
also helps in uh, further, like maybe walking and all catch.
Yes.
But there are kids who are fussy.
Yes.
And
Almost all.
all. Mine are.
Yeah.
And
Yes.
so if nutrition is helping you for the development, and then these kids are such fussy, picky problem eaters, then
Yeah.
what do you do?
So for nutrition, most important is how you wean them.
Okay.
It's very important. Like from 6 months, the weaning method should be very like started properly with a proper plan,
So
because children
from
need
6 months the weaning should be started.
6 months completed.
Okay.
That's when we start solids, right?
Okay.
So weaning means like starting solids,
Starting.
right?
Yeah.
Yeah. So that should be done very nicely, very methodically. Then only children get used to it. And most important is not giving up very easily. What parents do is they start one solid, child is not eating, they just refuse, they throw it away, then they get frustrated and stop. That's never going to work. You
So
have to be very consistent. Sorry?
I'm saying, no, you be persistent, like how the child is so
Yes,
persistent.
yes. More than him, you have to be persistent. That's how they learn.
Right.
And you have to keep trying, because if he is not eating one item, don't stop it completely. You have to keep on giving. And they will eat. I'm sure of that. Because it's all about habit. Because it's new for them also.
What did I have in I have twins. So when my
Okay.
girls 6 to 9 months they were like good, but after 8 months they can spit, right? Then they started
Yes.
even
Yes.
if they spit. So what are you supposed to do? We were like continuously feeding, but they're spitting.
Okay. No, then you just have to change for a few days. Don't give that item. Try something new. And what I recommend is once they start catching your, like trying to eat from your plate, use
Right.
that to your advantage.
Okay.
So keep their items in your plate and then feed from that.
Alright.
And when they start chewing, now, for example, my son started chewing at 9 months, 9 to 10 months, something. And he used to love to chew chapatis.
Okay.
So I used that as an advantage, and I
Right.
started giving him little chunky food, like soft but chunky. So he was able to chew. And once he started liking that, then he was able to eat properly.
Okay.
And yes, he also does the spitting. One bite he will take, then 2 bites he will. That's going to happen. You cannot
It's
escape from that.
like it's amazing. They're so creative.
Yeah,
Too.
they'll find all new ways to do it.
Yeah. So and also there's another issue, colic pain that keeps happening with these children.
Yes.
So to manage that? And when they're in that pain, because I was reading on your Instagram page about, the gripe water and all that, not, too much of sugar,
Yes,
which is not helping. So what do you do
correct.
when, and how do you prevent colic?
So for colic, what we usually tell them is you can give tummy time, lots and lots of tummy time. Actually, tummy time can be started by 1 month itself.
Okay.
And as long as they are doing on tummy time, gas problem is mostly resolved.
Okay.
And second thing, what important thing they have to remember is parents think that gas formation is bad. It's actually not the correct way. Gas will form
Yes.
because your baby is not walking, is not going for a walk to digest his milk. He's just sitting, sleeping in one place, drinking and farting. That's it. So gas will form. Gas has to be passed out.
Yeah.
Farting has to be there. Don't give medicines to stop farting. That's never going to work.
Right.
So you can use those medicines, not gripe water, because gripe water has soda bicarb also, calcium or gluconate also, and lots of sugar. And then there are some other which has dill seed oil, simethicone oil. You can try, but I have seen that even if you give it, doesn't work much.
So it actually doesn't. When the pain
Yeah,
starts
it
for
actually.
2-3
Yes,
hours,
yes.
they'll just cry.
Yes, it doesn't work. So only thing what you can do is daily tummy massage is the best. When you're giving massage, you can do that, and cycling exercise, like how
Okay.
we do for bicycle exercise for our abs.
Yeah.
The same thing is done for babies also, and it helps a lot.
Okay.
They actually fart 2-3 times just while doing the exercise.
Right.
Well, that is more than enough. No medicine as such.
Okay. And this
And for
teething.
the
Sorry.
no, we were talking about the nutrition also. One thing I would like to mention, like it is very important in development, and you should also start like solids has to be given and reduce at the same time reduce breastfeeding quantity.
Okay.
So what happens is if child is not taking solids, then mother keeps giving breast milk.
Right. Right.
Though it is very nutritious, but after 6 months, those nutrients are also less. So child
Right.
needs additional nutrients.
Right.
I have seen so many parents, like so many mothers, till 1.5 year, child is only on breast milk because he doesn't eat. Then they start developing all those bone problems and all that.
Drink milk.
Yeah,
Yeah.
that,
So
that happens.
solids, you're supposed to maybe the frequency should reduce.
Frequency should be reduced. Yes, correct.
Okay.
Because
Also,
if they keep filling their stomach on breast milk, then they won't eat. Then they will definitely refuse solids.
yeah.
Right.
So this teething, when they start teething and all, as they start getting more and more teeth, this solid food that we give them, it starts getting like first it is you give your dal water, rice water, and then it starts getting a little solid. So I have this one question. So I have a friend. Her son's about 2 years now, and he has just 8 teeth still. Okay, and she is super
Okay.
worried going to the doctor, and he very funnily tells her that have you seen an adult who has just 8 teeth? He will have his teeth, but as a parent, they're so concerned. Like
Yeah.
I'm sure 2 years and he's still on semi-solid because he just has 8 teeth.
Okay.
So how should they cope up?
But 8 teeth are more than enough to start chewing.
He doesn't have molars. He just has those front
No,
teeth.
that's fine. They chew on their gums.
Huh.
So molars are not actually needed.
Okay.
And basically teething range is from 6 months to 18 months. Like
Okay.
even for a first tooth, it can come by 17 months also.
Okay.
So
It's
if you
that.
consider, yes, there is a
Okay.
broad range.
Right.
So if you consider 80 that 2 years is more than enough. Nothing.
So that I understand how the parent must be feeling because
Yes, it's true.
so,
And most sad part is they compare. Like
yeah,
their neighbor must be having, child must be having 20 teeth, so they are like, okay, this is something wrong with my child.
true.
But no, front and the first center incisors and lateral ones and the down ones, they are more than enough to start chewing.
Okay.
Yeah.
Even like proper solid food.
Yes.
Okay. That's good.
So if they are smart, if they don't like chewing, they'll just spit it out. So children are smart that way.
But some kids like just swallow and this choking and all is not a problem.
So for that, see, when you say solids, it's like don't give anything with seeds, main thing.
Yeah.
Or
Yeah,
don't give anything like hard, like a dry date. So it should not be that hard. So you can give apple, little steamed. If it is hard, little steamed apple. Or banana. Banana is anyway soft.
Okay.
So that they can easily chew. Or don't give some hard items like biscuits or nut biscuits which you get, or dry fruits directly without making powder. Such items should not be given. Like easily soft, easily chewable items, you can easily.
Okay. And one very important point that I want to discuss, and I read it on your page also, is the calpol poisoning that you mentioned.
Yes.
So I just want to touch that. Also, simple question. This is my question. Like, if a child he's having a low grade fever and not really going above 100 for a longer duration though. So are you supposed to give paracetamol or you avoid?
No.
You
never.
avoid.
Yes, completely.
So
for children, according to new guidelines, actual fever for children is above 100.5.
Okay.
Not even 100. But for just to be on safe side, we say that if it is above 100, you can give medicine.
So you don't even bother?
Below 100? No. Below 100, not even one sip.
Okay.
So just observe. And also for children, their thermoregulation is not yet developed properly. So the temperature maintenance system. And it is very common that dehydration also causes fever.
Okay.
And we know children don't drink water enough. It is very common. So dehydration fever, and in younger infants, like babies and infants, one habit of covering them too much. Like one blanket, then sweater, then socks, cap, and all those woolen items. That also causes rise in temperature.
Okay.
But there is just a rise in temperature. That is not a fever wala temperature.
It's just body.
So these two, just body trying to produce heat. That's all. So always trust the thermometer, not your hand.
Okay. So even if it's a constant low grade.
Yes, nothing to do. Yeah.
Okay. And these seasonal allergies, they're too much. I think I was just reading in the comments also.
Yeah.
Seasonal allergies, even these babies go through?
Not really.
When they go to school, they get affected because of each other.
Yes. Somebody else will be sick. Then they start getting that.
Yeah, and what about the babies then?
Babies, no. If someone at home is sick, then they get it. Otherwise, no. Yeah.
Otherwise, they're not affected at all.
No.
Okay.
Because allergy takes time to develop, even if it is allergy.
And there's a lot of stomach flu also right now going on.
Yeah. Lots and lots.
So is this because we have just come through with this COVID, and because of that, the immunity has really gone?
Yes, definitely.
It's all like related, right?
Yes. Because unless you are exposed, your body is not able to fight it. Your body doesn't know how to fight. For 2 years, children were like totally isolated.
Yeah.
So they had no exposure to any pathogen for 2 years.
This viral is, and there's hand, foot, mouth.
Yes, hand, foot, mouth. Like almost for 3 months, every single child has gone through that.
But there is hand, foot, mouth. Like once the child has it, they say he can get it again, right? He will not have it.
Yes.
So
No.
So you're saying he will get it again. So when does this come into picture then, with regards to hand, foot, mouth?
Sorry, what does come into picture?
So till what age do they get immunized to hand, foot, mouth?
No, hand, foot, mouth doesn't have any vaccine as such.
Nah. Okay. So then
it's just a viral infection. The problem is it's very contagious.
So till what age then it doesn't affect them? After what age it is kind of?
Usually by 6 to 7 years.
6 to 7.
So elder kids usually don't get. Mostly below 6 5 to 6 years only, younger kids only.
Okay. Okay. And coming back to one more topic is thumb sucking, which I thought
Oh,
because kids
yeah.
babies are more prone to that.
Yes, yes, yes.
What do you have to say about it?
Thumb sucking, I would say you don't have to like stop it completely. Like just like don't what they do is apply some turmeric or some red chili or
Okay.
lemon to the thumb. Yeah, to avoid that. Don't do that. It's a natural instinct for them. It's a soothing effect for them. So let them do it. Just keep removing the hand when they go to sleep.
Okay.
That's it. Or when they start teething,
Uh,
because otherwise it will affect the teething process also. So that's it. So whenever you see it, just remove it. Nothing extra needs to be done.
and what is your take on pacifiers?
Pacifier is very like dicey thing. Like
Yeah.
if you use it, they get addicted to it. If you don't use it, then you are like don't know what to do when they are teething. So it's up to you. You can.
Even like when they're many babies, some babies like my babies cried a lot. They cried.
Mm-hmm.
You know, you don't have to wait.
Everyone doesn't like.
But it's okay. It's not a
Not must.
hard no, right, for it.
Yes, yes. You can use. It's up to you.
Yeah.
But you have to follow certain points.
How Indians look, when they see a baby and when they see a parent, oh, pacifier. Like it's like a tap.
Yes, yes.
So
So it's nothing. There are some advantages, some disadvantages.
Yeah.
And some precautions to take. As long as you do that, nothing.
Okay. Yeah. Then do you have anything else to enlighten us?
No, I think that's enough. Yeah, I would like to mention two things. One is I get this measles.
Yeah.
Now, recently there was in news in Mumbai there is an outbreak. And I also started getting many queries that is it very dangerous, what it is, and all that. So I would like to tell them whatever happened in Mumbai, in that specific area, all those children were unvaccinated, unimmunized.
Okay.
All of them. Not a single one is there who was vaccinated and still got measles.
Okay.
So as long as your baby is vaccinated 2 doses of MMR, which are available in government and private, then you don't need to worry.
Yeah, that's a good point.
Yeah, all of them were unvaccinated. And second thing is for COVID vaccine, like there is still going on 12 years and above. It is available in the CoWIN app also. And sadly, so many people have not taken COVID vaccine yet, even to their children.
Yeah.
So they should take, because now COVID has become a routine.
No, but
we are still seeing COVID cases.
For children, will it be safe? Like, because the studies have not yet been done that much, So for children, will it be okay taking that?
For 12 years and above, studies are published. Yeah. No, younger they haven't. For younger 5 to 12 years, they have not started yet, because studies are still pending.
Okay.
But at least 12 years and above, they should. Because see, same goes for flu vaccine also. We keep telling parents, especially those who are going to school, they should take flu vaccine yearly. Because swine flu is very common. It's now become as a routine for us.
Yeah.
And they still don't take flu vaccine. Now COVID will be added to that. COVID vaccine is also going to be a yearly thing.
Yeah.
And parents have to take themselves also and give it to the child also. It's very important.
Right.
Yeah. Then that's it. Yeah.
So
for developmental milestone, I would like to add just last thing that whenever you have doubt, visit your doctor.
Yes.
Don't Google, please. Yeah. Don't Google, because there are many things before labeling your child as a delayed development. Plenty of things we need to check. So always visit, and always remember that there is a range. Every child has a limit, or every child has little bit of delayed development is always there. Like some children do all the things properly, but one thing is delayed. That is very common. Doesn't mean anything wrong with your child.
Yeah.
So always follow your doctor's advice, and that's it.
Always focus on your child.
Yes, correct. Don't compare. Don't compare and don't Google, please. And if you Google, don't come to us, please. because it becomes very difficult to explain once they are Googled.
Right.
Yeah. That's it then.
Thank you. Thank you. Actually, you know, the right knowledge coming from the right person is most important, and
Yes.
that is what actually helps. So thank you very much, and we look forward to having more discussions on other topics.
Yes, sure.
Shall meet soon. Thank
Yes,
you.
yeah, definitely. Yeah, thank you so much.
Have a good day. Yeah.